Okay, this is going to be the first video I've ever made. My name's Sean Mendes. This is for Anatomy 235 at University College. And this is the anatomy language assignment. So I'm going to just be pointing out to a few terms here and what they mean on the body. First one, I have the handout here open as well. The first one is the hallux, and that's going to be referred to more commonly as the big toe. So here we have our skeleton, and it's this right here, the big toe. Axillary would be your armpit, as it's more commonly referred to as. Next one is the buccal. That's cheek. I'm pretty sure that's pronunciation, but I'm going to have to look at that up more further. The pollex is your thumb. That's going to be this area right here. Patellar is your knee, right here, right here. That makes more sense. Patella, patellar, makes more sense. Oral is obviously here, your mouth. Mental would be your chin. Brachial, that's going to be the upper area of your arm, right here, brachial. Yes, brachial. Antebrachial is below the arm, so that's going to be your forearm right here. This forearm. Crural, that is your leg. Okay, so it's pointing to more so the shin part of your leg. So this right here. Umbilical would be your umbilicus, or your belly button. Let's see, femoral, that's going to be where your femur is, so your thigh, right here. Femur, femoral. Let's see, what else? Next one, letter N, calcaneal. That is going to be, I don't have them all memorized yet, as you can tell. Calcaneal. That's the back of your heel. Okay, so that's going to be right here. Right here. That's your calcaneal. Next is sural, which is your calf. Then there's popliteal, which is here, the back of your knee. There's a pulse there, but yeah, this is the popliteal. Olecranial. That's going to be the back of your arm, sort of the tricep area. Acromial, I believe that's your shoulder. Yes, it's your shoulder here, right here. And occipital, that would be the back of your head. The back of your head. Okay, now moving on to the directional terms as I scroll down here on my handout. Head is superior to the sternum. So let me move our friend here. Okay. Head is superior to the sternum. So the head is above the sternum. Yes. Going upwards. The olecranon is distal to the acromion. So that would be the back of your arm is distal, as in away from the shoulder. Okay, that makes more sense. Because distal is meaning coming away. Yes, coming away. So acromion, olecranal, coming away from that. Okay, the axilla is proximal to the brachium. So proximal, I believe, is closer to the origin of the body part. Perfect. So axilla is proximal to the brachium. The nose is medial to the eyes. So medial is coming more into the middle. So my nose, right, medial, toward at the midline of the body. Medial. My nose is medial to the eyes. The elbow is proximal to the carpus, closer to the origin of body. So proximal means closer to the origin of the body. So my elbow is closer to my body than the carpus. The sternum is anterior to the vertebral column. Okay, that makes even more sense because the sternum is closer. It's coming towards the frontal part of the body, so it's anterior to the vertebrae, or the vertebral column. The umbilicus is inferior to the sternum. So you can't see on this guy, but the umbilicus would be right here. Okay, it's inferior, as meaning going down to the sternum. Okay, the patella is proximal to the tarsus, and proximal, I believe, was closer to the point of origin, was it? Closer to the origin of the body part. So point of origin of the body part. Patella is proximal to the tarsus. So here's your patella, and it's closer to the origin than the tarsus. Okay, the ears are lateral to the nose, and lateral just means away from the midline of the body. So your ears are lateral to the nose. Okay, now the last part, I'm going to be marking off, let me put our friend away here. I'm going to be marking off the abdominopelvic regions. There's 9 of them. I was only aware of the 4. I forgot all about the 9 until we dive deeper into this chapter. And I could not find any masking tape for the life of me, although I'm going to be explaining more so orally and showing just with this measuring tape that came in the lab pack. But essentially the abdominopelvic regions are broken up between 2 medial, what are they called, sagittal planes, so like this, and then 2 transverse planes, kind of like this. Okay, so 2 medial sagittal planes, and then 2 transverse, making 9 areas in total. 1, 2, 3, 4, 5, 6, 7, 8, and 9. Okay, and these areas are called, starting with the right hypochondriac region, your right lumbar region, and your right iliac region, also known as the inguinal region. Here in the middle, we have our umbilical region. At the top, our epigastric, meaning the top of our gastric area, and then our hypogastric area down here at the bottom. Moving to the left, my left, we have our left hypochondriac region, our left lumbar region, and then our left iliac region again. And so that's pretty much the 9 regions. Some organs that are involved in each region is here in our right hypochondriac we have the liver, a little bit of the gallbladder. The epigastric contains mostly our stomach. Yeah, mostly our stomach here. Do we have some liver there too? Looks like it. And okay, the left hypochondriac, we have some more stomach and spleen. Okay, and then let's see. Below on the left here, we have our transverse colon, descending colon, and then below that in our iliac, we have the initial part of the sigmoid colon. Okay, and then in the hypogastric region, we have our urinary bladder down here. And then on the right side, it looks like we have some cecum and the appendix. Okay, and then moving up onto the right lumbar region, we have small intestine. No, we actually just have the ascending colon of the large intestine. And I believe that's all of the regions. As you can tell, I don't have them all memorized now, but I continue to plan on studying those and getting those down throughout our study of all the systems. Again, my name's Sean Mendes. This was for the University College at APU Language of Anatomy video for class 235. Thanks for watching.